Hi everyone, and welcome to our update on the Pediatric Falls Strategy, brought to you by the Pediatric Quality and Safety Council. The Pediatric Quality and Safety Council was developed to promote improvement in care and therapy across the pediatric division.
Over the past several months, committee members have been busy working to redevelop our current Pediatric Falls Strategy to ensure our strategies are tailored to best meet our needs.
As many of you are aware, the Glen Rose is undergoing accreditation in May. Falls prevention is one of the identified areas accreditors will be looking at. The following presentation helps to ensure you're aware of the guidelines and protocols we have in place to protect our patients and meet accreditation standards.
We started with a comprehensive literature review to better understand best practices for pediatric-specific falls prevention. We then benchmarked several similar pediatric sites across Canada to learn how others have approached this work. Throughout this review, we worked closely with our teams to better understand our specific needs.
Because our pediatric services are unique, we identified a need to develop 3 different strategies that best meet the needs of each type of service. The 3 types of service are inpatients, day programs and outpatient treatment, and outpatient clinics.
Although there are 3 different strategies to meet the 3 types of service delivery in pediatrics, universal falls precautions are standard across all services. Examples include staff education, patient and caregiver education, and routine environmental safety checks.
All patients admitted to Unit 201 have their falls risk assessed using the Stollery Pediatric Risk Assessment and Intervention Tool for falls, entanglement, entrapment, and strangulation. Due to the nature of conditions for which children are admitted to Unit 201 or inpatient rehabilitation, they are typically classified as high risk for falls. We employ all universal interventions such as assessing for adequate lighting, encouraging appropriate footwear, and making sure the patient's call bell is within their reach. We also ensure that patient-specific interventions are employed for all our high-risk patients. These include, but are not limited to, using lift and transfer aids, moving patients closer to the nursing station, and accompanying all patients when toileting and ambulating. Ongoing staff education, post-falls huddles, and reporting of all falls enables us to be diligent about protecting our patients.
For outpatient treatment programs, we've determined that our kids are at high risk for falls. For that reason, we have adapted a tool to determine why the kids are high risk and to identify specific strategies for each child. This is in addition to universal strategies that are employed throughout pediatrics. For example, if one of our kids was high risk because of hyperactivity and inattention, we would want to make sure that the doors were always closed and a team member kept their eyes on that child.
Our third strategy has been tailored to specifically meet the needs of our outpatient clinics. Due to the nature of the patient populations we serve, every patient that comes to clinic presents with one or multiple risk factors that place them in the high risk for falls category. As such, high-risk falls prevention strategies are implemented by all staff with all patients.
Staff and caregiver education regarding risk and prevention is a key component of the Pediatric Falls Strategy. Caregivers are reminded of their responsibilities for keeping their kids safe while at the Glen Rose during intake and scheduling calls. Caregivers are also reminded to ensure that their kids are wearing appropriate clothing and footwear for the clinic visit. Upon arrival at clinic, caregivers will be given a handout about falls, risks, and prevention strategies for use at home, in the community, and while here at the Glen Rose. Posters are placed in hallways and clinic and team rooms reminding caregivers and staff of falls, risks, and prevention strategies.
Equally important to all staff being educated is actually implementing high-risk prevention strategies during every patient interaction. A few key examples include clear communication between staff and caregivers regarding risks and who is providing direct monitoring and care during different portions of the clinic visit, assisting with transfers as appropriate and utilizing transfer devices as required, ensuring clear communication when giving instructions to the client and caregiver during specific rehab assessment procedures, standby hands-on assistance as needed during specific rehab assessment procedures, behavior management for impulsivity, and ensuring brakes are engaged in all movable equipment.
Keeping the clinic environment as safe as possible is also important. PEDS safety reps complete routine environmental hazard checks throughout all clinic and outpatient spaces to ensure any potential hazards are identified and fixed. Staff preparing the clinic rooms before rooming each patient also complete regular environmental hazard checks. And as always, Glenrose housekeeping staff ensure that hallways and bathroom floors, etc. are clean and free from slipping hazards.
So despite all of our efforts, sometimes falls occur. In all cases, staff should make sure the child's immediate needs are met and report the incident in the Reporting and Learning System, the RLS. Depending on the severity of the fall, staff may need to notify the clinic or program nurse, who will complete a more formal assessment, notify the clinic or program physician, call a nursing response, or a code blue. If you are looking for more information or clarification on the pediatric falls strategy for your area, please contact your service coordinator, program coordinator, or look in the GRH Falls Risk Management folder on the P drive.